All right, couple more minutes. Just make sure we've got everyone. Thanks everyone for coming. We're waiting on one more person actually, so I'll give them another minute. But thanks for joining us. Hopefully you can see this full screen. View enter full screen mode. There we go. Like everyone else, we've got multiple tabs open. There we go. Hang on, let's let them in. Awesome. We've got everyone. Thank you for joining us. Today we are going to follow on from our first session. Last week's session was on why we sleep and why we need to sleep, and we'll touch base on that straight away. And just to recap there, so we talked about ourselves as human beings being solar-powered humans. So we rise when the sun rises and we go to sleep when the sun falls down. The sun is a powerful stimulator of hormones within our system, and that can increase our wakefulness and also can decrease our wakefulness or make us sleepy when we're not exposed to sunlight. And we're going to talk about that today and how we can use that in the workplace to our advantage. The second thing we talked about why we sleep was this idea of sleep pressure. So the longer we are awake, the more pressure that we have to go to sleep, or the more pressure we have for that loss of wakefulness. And we talked about caffeine and its effect on this sleep pressure and it removing or blocking the adenosine receptors. And that's how caffeine works within the brain. It blocks the action of adenosine in the system, allowing us to remain wakefulness, and the half-life of caffeine being 6 hours. And why that might be, some people in the workplaces, their challenge is getting to sleep at night, is those coffees later in the day. We also did discuss these concepts of sleep health. So what happens when we get to sleep, or in the lead up to sleep, and what happens when we get to sleep really impacts our restfulness or our sleep quality. We talked about a minimum of 7 hours. We talked about actions that lead to a quality sleep. We talked about this consistency, so keeping a consistent bedtime and wake up as best as we can, and the timing of sleep and this idea of sleep personalities. And if you missed out on that, we did record that session that you can view. But today's session is really on fatigue management. Oh, we have one more person popping in. We'll let them in. Fatigue management. So how do we look after people in the workplace? And the mantra really is around how to get tired workers to the end of their shift safely. So what we're treating this fatigue in the workplace is a specific safety hazard, and it's probably something that is not taken as seriously as it should be, right? We know that tired workers make more accidents. We know tired workers have more acute and chronic diseases. And we know more tired workers have injuries in the workplace. So as a manager or as a leader in the business, what are you doing when you see tired workers in the workplace? What sort of controls do you have in the workplace to look after tired workers? And remember our mantra, get people to the end of their shift safely. So often fatigue errors in the workplace is the final point of a chain of events. So when people have looked at fatigue in the workplace leading to things like Chernobyl, there's often a number of errors or misjudgments that are made due to fatigue that compound and then end up with that final catastrophic event of maybe a death in the workplace, maybe a serious injury, or a huge accident in the workplace. So when we look at managing fatigue in the workplace, we need to take it more seriously. We need to start taking this safety management approach. And what it does do is it shifts the context when we're dealing with this as a risk in the workplace from a diminished capacity to voluntary impairment. So, just really recognizing that a worker's job is to turn up to be fit and ready to do their job. Sometimes that is impeded. Maybe they've had a newborn baby, maybe they got a poor night's sleep last night, and as a leader in the business, putting some controls and some safety things in aspect, and think of it like the hierarchy of controls. And we're going to go through that. But what can you do to get this person to the end of their shift safely? But also on the flip side to that is this note that this voluntary impairment. So this worker is turning up to work in a reduced capacity. And how do we look after this person? And not just in that short term to get to the end of their shift safely, but how do we help this person look after their sleep so that this doesn't keep happening? And I'm sure we've seen this in workplaces where someone keeps turning up to work tired. They keep yawning at the toolbox or the startup meetings. I mean, I've worked at workplaces where people have fallen asleep on the job, and not just in an office chair. You know, these are people working in serious workplaces that might have to get underneath a machine to fix it. They might get opportunities in a break, and they have these naps or they fall asleep during these sessions. And if this is consistent, this worker needs more than your help to get to the end of their shift safely. So what does fatigue look like? Because that's the first step, right? Identifying it. We often coach our workplaces around Australia to, at the startup talks, for people to raise their hand. You know, is anyone feeling tired, or is anyone ready to reduce capacity today? Did everyone get a good night's sleep? These questions are not often answered. And that's why, as a leader, you have to be on the lookout for some physical signs. And we all know what that looks like: yawning and rubbing their eyes. Mental symptoms, you know, that could be being irritable. It could be being angry, and there's the angry birds there. That could be forgetful, and that's often a clear sign that someone is at a reduced capacity. Is this short-term memory function is reduced. Emotionally, like I said, angry or irritable. But as leaders and managers in the business, just a change in their behavior, a change in that person's presentation to the workplace today might require your intervention to get them to the end of their shift safely. Often something that's blocking individuals from having that conversation is, what do I say to this person? What can I do to help this person? And just briefly in that space, we would be recommending you to have a one-on-one conversation. Offer it at a toolbox meeting to people to put their hand up, or at the start of their shift. But if you do recognize these signs and symptoms, then having access to that person in a one-on-one setting so that you can ask the right questions. Broadly speaking, we'd be asking these more open-ended questions where we're not encouraging this person to give a one-word answer. Like, how are you? I'm good, thanks. Yeah, great. This doesn't really allow us to expand on this person. It doesn't give us any more information from this individual if they are fatigued. If you do notice those signs, one of the great open-ended question that we can use is, how can I help you get to the end of the shift safely today? I've noticed this. How can I help you get to the end of the shift safely today? So just keeping it really, putting the responsibility in their hands. How can I help you? And them offering you some advice on how they can get to the end of their shift safely. So really focus on approaching this person one-on-one and more of those open-ended questions, which allow you to get more information and maybe some solutions from these individuals. And as I discussed, when we're looking at this safety management approach, something that sticks in people's minds that they've might seen before is this hierarchy of controls, where we have elimination of risk, substitution of risk, engineering some controls out, administrative controls, and then putting some personal protection in. This is something that's existed for a while, and we just take that approach or that idea and we apply that to fatigue in the workplace. So if you have noticed someone that might be struggling today, yawning, tired eyes, irritable, then these are some controls that you can think about. And these are quite flexible. And I've had some quite innovative ideas from people on the floor, because that's where really good innovative ideas come from. And if you do notice someone's tired in the workplace, the first step is to eliminate the risk. And that's removal of the high-risk tasks on site. Eliminate the risk doesn't mean sending them home. And in fact, that's the last point of call for us when we're looking at someone on site who might be managing their fatigue. But just remove them from those high-risk tasks like driving cranes, driving vehicles, operating machinery where lots of judgment is required. And that is a significant risk reduced in your workplace straight away. Overtime removal. So removing that risk or moving that opportunity for that individual to access overtime because you've highlighted this as a risk in their workplace. A nice one is buddy system. So if there's opportunities in your workplace for people to work in teams, completing tasks, removing them from the high risk task and putting them in a task where they can do some buddy work is really good. That increases the supervision of this individual and again helps them get to the end of their shift safely. Increasing the rest breaks, as we discussed last week, the coffee breaks, so that blocks the action of adenosine in the brain, removing that sleep pressure and increasing the wakefulness for individuals and giving this person access to more rest breaks during their shift, which might mean an extra morning tea, and think about the high risk times. If they're on a night shift, it might be from that 2 a.m. to 4 a.m. window. If they're on a day shift, it might be that early afternoon, just increasing and offering this if you've noticed that fatigue is a problem for this person today. Hey, how are you feeling today? How can I help you get to the end of the shift safely? Look, I'm thinking about offering you an extra break in the early afternoon. I'm going to increase my communication to you through the shift just to make sure I can get you to the end of the shift safely. But how does a break sound from 2:30 till 2:45 today? Just get some sunlight and get some coffee. So that's a great way of changing in the communication. You're going to check in with this person more often during the day. You're offering them a break to get them to the end of the shift safely. And you're increasing that supervision by that change in communication. I've also said, make sure you get some sunlight from 2:30 to 2:45. Again, we are solar powered humans. And if we get sunlight, that increases our wakefulness. That's how the body works. That's also how the body works if we're scrolling in bed at night and that light that's coming from your mobile phone or from your iPad, that's something that increases our wakefulness. And it might be the problem that's keeping you up at night as well. And the last one there is really seek help. That's quite a challenging task in today's medical system. And in fact, I built a business around sleep health because there wasn't a lot of options available for my staff as a physio. I was treating patients all around the nation, and sleep is, in my eyes, the number one foundation of health. If people had a problem with their sleep, such as sleep apnea, insomnia, restless leg syndrome, shift work sleep disorder, sleep when I'm dead disorder, any of these issues are a big problem in the workplace and they need to be addressed, but people often don't know where to turn to. At HealthStack, we offer sleep health professional consultations with individuals so they can access that information and talk to a real health professional to get solutions. Alternatively, individuals can talk to their doctors and look at getting sleep tests. So a conversation with the GP usually leads to a referral for a sleep test, usually refers to the visit at a sleep center to get the device, and then performing that test and getting some results back from a sleep health professional is really important. There's lots of devices and gadgets out there these days that can track your sleep. I'd encourage Sleep Cycle is a great tool for individuals to use. It's just a little app that you can download for free that can wake you up at the most appropriate times and maybe increase your wakefulness during the day. The Whoop watches, the Apple watches, these things are getting quite diagnostic now and can give us a lot of information about your sleep. You can get private sleep tests that you can purchase through ResMed, through the Good Sleep Co. These private businesses offer sleep tests delivered to your door as well, and they're two great companies to look at. If you want to do a private sleep test delivered to your door, they're around $100 to $200. And they're more diagnostic around this idea of sleep apnea. And that's someone who's usually getting a lot of sleep, but when they wake up, they usually got a dry mouth, they're usually irritable, they're usually fatigued and grumpy. And this means they're not getting the quality of sleep when they're going to sleep as well. These issues might be present in your workplace, and it's really hard for you to know as a leader or manager in the business if people have these conditions. But if you keep seeing people turning up to work as a risk on site because of fatigue, and you keep putting these controls in place, is this person right to do this job? If not, they need to seek help. You know, they need to get the access to support, and that's what we prioritize in Health Stack, is looking after individuals. So if we have any questions, please pop it in the chat now. This will be available online as well for those that didn't make it. But thanks everyone for listening. Short, sharp and fast. Look after yourself, and remember, let's get our tired workers to the end of their shift safely.